And while we are all getting into the spirit of the holidays, we often lose sight of those dealing with medical issues like dementia and the caregivers that look after them. Holidays can be a challenging time for both. So joining me now, Dr. Alexandra Sibley, a geriatric psychiatrist with Legacy Community Health, joining me to discuss. Good morning, Dr. Sibley.
Good morning.
So first off, why are the holidays considered kind of a disruptive time in these families' lives?
I think a lot of times is with a loved one with dementia, a consistent routine is very important. And going to holiday parties, having family members come in, it disrupts that routine. So it can promote behaviors that may not have happened if the person would stuck to the routine. I think you have to remember that the loved one with dementia is doing the best they can. And so in terms of the holidays, it's up to the family to modify what you may be doing for the holidays in order to ensure a good holiday.
Yeah, sometimes those routines are the only easy part of their day is sticking to that. But we all know the stories of caregivers and how challenging that job is to begin with for them. Now, during the holiday season, how would you suggest that we support them during the holiday? And maybe if you're an out-of-town relative coming back into the family dynamic for the first time, is there something that we can do or bring to make it a little bit easier on the caregivers?
I think just having a conversation with the caregiver about how things are going so you're up to date and kind of know, but also offering respite. I think that's one of the best gifts you can give, really. Saying, okay, well, I'll watch Dad for an hour. I'll sit with him while you go take a bubble bath or go do what you need to do for your own self-care. And I think, if someone is a caregiver, the family helping out with more of the traditional task of cooking and decorating might be also appreciated.
Yeah, and I do want to emphasize that people are coming into town and treating it sometimes like a vacation, but really carve out some time to give that caregiver a break. They really need it.
They most certainly do. Caregiving is it's a very meaningful role, but it can be very challenging, especially during the holidays. I think it's also just important for if family comes around, instead of asking the loved one with dementia, do you remember who this is? Just kind of stating their name. This is Sally, she's your niece.
Yeah, and sometimes when they don't remember, it can feel a little bit hurtful, but just keep moving on with that conversation.
Yeah, I think and that's also something you can prepare the family for. It's not personal, it's part of the illness. Also, a lot of times people who have dementia may lose the social graces and will kind of say whatever thought comes into their mind. And realizing they're not meaning to be rude or offensive, it's just they've kind of lost the filter on what they're saying.
Yeah. What are some ways that we can incorporate that family member with dementia into holiday traditions? Like, is it good to get them involved in maybe songs that they always liked or baking that they might have once enjoyed? Or is that just going to add to the confusion and hurt that sometimes comes with the disease?
It depends on the individual person, but also kind of where they're at with their symptoms. I think you can always try, but if something you can kind of see it's not going quite right, kind of shift to something else. I would say that like large parties with a bunch of people you may not know, probably best to be avoided. Probably best to have a small social gathering with immediate family.
All right, Dr. Sibley, I hear a lot of what you're saying is have some flexibility going into this holiday season.
Flexibility is key. Just being ready to kind of roll with the punches, so to speak, and go from there.
Dr. Sibley, you are awesome, and this is such an important topic. So thank you for joining me this morning. We really appreciate it.
Thank you for having me.